The Imperial Valley's AM 1230 Kxo El Centro, California. We are looking at day 9,483 of the pandemic. And, well, as has been our custom on a Friday morning, we are visiting with some folks from Imperial County, the Imperial County Public Health Department, that can give us some insights into the pandemic and what's actually going on. With us on the phone today is the Imperial County Public Health Department Director, Janette Angulo, and Imperial County Public Health Officer, Dr. Stephen Munday. Good morning.
Good morning, Carroll.
Good morning, Carroll.
It's another beautiful day in the Imperial Valley, and, well, the weather may be right, but when we take a look at the numbers, what Dr. Fauci and so many experts predicted is happening. We're seeing, well, what would be COVID pandemic 2.0, right?
Yes, sir. Unfortunately, we are. Everyone in the public health community was concerned that the fall would bring a surge with it because if you look at the pattern of respiratory illness prior to COVID, influenza, of course, is the one that we talk about the most, but there's plenty of other respiratory viruses out there. But at this time of the year, we see an uptick, and there's a lot of reasons for that, but not least among them is that as the weather cools, people tend to spend more time indoors and more time close to each other. And of course, that facilitates transmission. And you know, we've watched this sort of move across the country. I'm sure everybody is aware that the Midwest has really struggled recently, and California had been relatively unscathed in this COVID 2.0, as everybody likes to refer to it. But now, unfortunately, we're starting to see the uptick occurring here as well. And of course, we're focused on Imperial County, but it's not unique to us. I'm sure everyone is aware that many counties had to take a step backward in the tiers and move in from red to purple in this week's COVID state website. And there is a concern that counties may have to move out as we go forward. So we're watching all of this closely, and you know, we learned a lot from our first surge that occurred in the spring and the early summer. And we did a lot of things then to respond to that and learn some things from, and so we haven't just been sitting around waiting for this. We've been preparing so that we could do as much as we possibly can once the surge continues. And you probably heard the press conference yesterday, but the hospitals have been very involved. They've been doing a lot of work, and I want to thank them for that because, of course, we cannot manage this outbreak without their assistance. Lots of other great people in the community as well, the clinics and private practices, the county medical have all been in contact and communicate, and so it's allowed us to get information out, to share messaging, to make sure that we can get testing to the community where we need it, that we have the contacts we need to do our contact tracing, and also that we have been in close contact with the schools because, of course, that's a large population of our kids that we're all wanting to make sure that they can stay healthy. So a lot of work's been going on to prepare for this, but that doesn't mean that it's not going to be a difficult time. And so the message that I would want to share is that all of this discussion that we've had about the importance of not gathering, distancing from people that don't live with you in your household, including members of your family that don't live with you, masking at all times when you cannot distance, it's just super important that we keep doing these things. I know people are getting tired because it's been going on for over 9 months now, but it's just really important. The good news is that we've had some positive results on the vaccine front, and so we're watching that carefully. We'll get more information about the vaccine that we've been discussing, but we'll be hearing about other vaccines quickly as well. And then also on the pharmaceutical front, we now have a monoclonal antibody that's being used under an emergency use authorization from the FDA. And there has been an allocation of that from the federal government to the states and from the states to the local health jurisdictions. and we are working on our partners about the best way to take advantage of that medication as it becomes available to us. So lots of stuff going on right now, and I'll stop and see what other questions you have.
Well, I will just make some observations that may lead to further comments. The Pfizer developed vaccine that has been shown to be about 90% effective has to be kept at like minus 90 degrees. Now, the good news on that is El Centro Regional, as well as the county, have the freezers that can do that. El Centro Regional has them because they've been part of the clinical trials. And so some of the transportation and storage issues with that vaccine, we've already met here in Imperial County. But one of the things both Larry Lewis and Adolph Edwards said yesterday in the press conference is the local healthcare facilities are pretty much slammed with COVID positive patients. And out of 118 total patients at El Centro Regional, 47 are COVID positive, 16 ICU beds, 14 of them right now occupied by COVID patients. You know, one of the things that is stressed is, okay, you may not die from this, but look what it is doing to the healthcare facilities and the healthcare workers. You know, when has an RN had a day off, or a respiratory therapist? You know, these issues are major in the healthcare world. The vaccines, when they become available, how will that be distributed?
So so it's not actually minus 90. It's not quite that bad. It's for these RNA vaccines, which are the ones that require the super cold freezers. It's between about minus 60 and minus 80. That's still really cold, and it does require special types of freezers. And to your point, we knew this was coming, and so there's been a lot of work behind the scenes to make sure that we do have the capacity that we need. Some of it, of course, is in terms of procurement and trying to get additional resources. But I would note that we already have some specialized freezers in different locations because, for example, there's certain laboratory specimens that require these super cold freezers. And of course, those weren't intended for vaccines, but they can be repurposed. So some of it is repurposing some of the that we have now, and some of it, of course, is getting additional supply. A lot of that work is going on. In regard to healthcare workers, I mean, it's no doubt that healthcare workers are heroes right now, and the amount of stress on them while they're really trying to do their jobs to save people's lives, to keep people safe, to prevent transmission, and of course, at the same time, trying to keep themselves healthy, take care of their families, et cetera, is just amazing. And you're right, many of them have hardly had a day off in this year because they've just been busy trying to do their jobs. And we just really have to say thank you to them, because if it weren't for the amazing work that they're doing, and not just them, so many different groups of people at every level. I mean, if you look at our first responders as an example, if you look at the public health community, if you look at the government, it's not just public health. There's an all-of-government response that's really taking place to try to deal with this outbreak. So there's wonderful people in all walks of life, all kinds of different jobs, really just busting their rears right now to try to make sure that they can keep people safe and to try to limit the spread of this outbreak. And that's why, honestly, I think it's so nice, at least in this last week, we had some good news to share with everyone about the fact that we do have what looks like it's going to be an effective vaccine, as well as some effective pharmaceuticals. With regard to your question about how we're going to disperse this, there is a lot of discussion that's been going on. And we do know that, no matter how soon the first vaccine does become available, that we're not going to have enough doses to give it to every single person if we want to have it. So we are going to have to make decisions about how to allocate it. And so the focus is going to be initially on healthcare workers that are in the highest risk settings, because we'll have a small number of vaccines. And of course, we want to target the highest risk population, just because they're in the over COVID, but also because, to your point, we don't have enough healthcare workers. And if they start getting sick and they cannot work, then that's going to get us into trouble. So that's where our initial focus is going to be. Then as additional vaccine becomes available, start expanding the circles that we will be offering it to. And as we get more to just regular patients, you'll see the focus will be on the highest risk patients first. So for example, skilled nursing facilities will be a place where there'll be a lot of focus because those are clearly super high risk scenarios. But also other settings as well, where you have people who are older and who, in addition to that, have other health risks that put them at increased risk, not so much of contracting COVID, but of having severe disease once they get it. As then additional vaccines become available, then we'll expand that to larger and larger groups of people. And eventually, of course, we'll hope that we'll be able to vaccinate everybody who wants to get vaccinated. And that's not just going to be the Pfizer vaccine. This is going to be a multi-pronged approach. We will see additional vaccines become available because that's the only way we're going to have enough of it to go around.
Okay. Now, other positives, Dr. Edward at El Centro Regional said next week you will see an additional 50 med-surg beds appear at the Ross Avenue entrance to the hospital. Temporary facility, in effect, somewhat like a MASH unit might be in the Army, but that hopefully will help because, okay, we're seeing a surge. Some of it may have to do with Halloween. We've got Thanksgiving coming up. We've got Christmas coming up. And, you know, people are not going to, they're going to get together with family and friends. And so, you know, past history, we're liable to see some significant surges following days, right?
Yeah, so just with regard to your comment about the additional hospital capacity, you are absolutely correct. We learned from what happened with our first surge. And, you know, that didn't just suddenly happen in a few days. We've been working on that increased capacity for actually a few months because we knew at some point this was likely going to come and we wanted to be prepared for it. And it's not just having, you know, 50 beds or 75 beds or 100 beds, whatever, you know, the ultimate number is. To the point you made earlier, it's making sure that we have the personnel that we need, because if we cannot staff the beds with the right level of healthcare personnel, then they don't serve a useful purpose. So all of that has been taking place. With regard to the holidays, you're right. Unfortunately, the respiratory season falls when we have our most important holidays. I mean, there's no more important holidays in general for families in terms of gathering than Thanksgiving and Christmas, and we understand that. And so there's going to be additional messaging coming out at the state level, but also from the county as well, to really just ask people that we understand how difficult it is, but that it's really important that they do need to continue to follow the public health guidance, and that they do need to distance and mask and to not to gather. And it's not just about yourself. It's about keeping your loved ones safe as well, because we know that there is absolutely no higher risk scenario outside of a high risk healthcare setting that will transmit this disease easier than household contact. And so we're going to continue to push that message and really try to encourage people to try to avoid gathering so that we can limit transmission as much as possible. Okay, I have a question for Janette. And, well, you know, you can put down the crossword puzzle. And, okay, how about testing? OptumServe in Brawley. And, by the way, you must make an appointment. And
last 3 or 4 times we checked, they are not accepting walk-ins, but you can make an appointment. They happen very quickly. What about other testing?
So, since we have Dr. Munday on the line, and it's the first time he's been with you this season, Dr. Munday, you want to talk about what's going on with testing?
Sure. So obviously Janette and I are, locked at the hip on all of this stuff. So we've been working a lot on that. And so the state testing task force has been working with all of the individual counties to try to improve testing capacity. And so there's been a lot of discussion at the individual level. We've had meetings directly with the state and each individual county. As you can imagine, with 58 counties, it took a little bit of time for those meetings to take place. But the state put out a model where there were different options to do testing. One of them is the model that we have already been participating in, which is that OptumServe model, a fixed site that people can go to. But there are other models as well that look at, for example, basically a big RV, for lack of a better way to describe it, that has all of the testing supplies and personnel that can be moved around to do testing. Also, mobile strike teams where you have people that can go to a particular location with supplies and collect specimens. And so we've been working with the state to implement those options in the county. The state is now getting back to us in that regard. Additional testing capacity is going to be made available to us. We're going to be sharing the details of that very soon because we're finalizing those right now. But the gist of it is that we will continue to see that OptumServe site used. We've only got one, and as we did have a total of 4 lanes when we were in our surge last time, and then as people stopped using them, and they were really sitting empty. And of course, that is an expense of the taxpayers, not Carroll County, but of the state as well. And we want to be good stewards of the taxpayers' money and also make sure the assets are being used where they are most needed. So that's why we went back down to 1. Having more fixed sites, I don't know that is necessarily the best way for us to do this. So we decided to continue with the 1 fixed site, but to work on these more flexible options that we can use, say, for our skilled nursing facilities, for our jails, in our clinical setting, but also so we can really, really focus on our highest risk workers, i.e. our agricultural and farm workers who have the most difficulty to access testing. So there's been a ton of work going on in that regard, and we're expecting that this coming week that we're going to be sharing details of the additional plans that are in place to help us respond to this outbreak. Along the same line, the state has opened a new lab. They've always had their lab, but now they have this new lab that's in Valencia, which greatly expands the ability to do testing, and that will help us to continue to get our test results back in a timely manner. Because honestly, if you're not getting the tests back quickly, the results are not very helpful because it doesn't give you the opportunity to intervene in disease transmission, which is what we're really trying to do. So lots of work going on in that regard, and we're anticipating that we're going to be sharing some very good news in the very near future.
Okay. Now, switching a little bit, we can't forget flu, the influenza, and the impact that is going to have. Of course, everyone is urged to get a flu shot, but are we seeing a spike in just the regular, ordinary run-of-the-mill flu?
So it's very early in the season. We don't typically see widespread this early in the year. It's not impossible and it's unusual. It typically really starts toward the end of the year or even into early January and then kind of goes into the early spring. That being said, we are already detecting flu cases. So it is definitely circulating in the community, not necessarily widespread at this time, but it is absolutely happening already. And the thing that I would keep at the forefront is the exact same things that we're doing to prevent transmission of COVID are the things we want to do for flu as well. So if people are distancing and they're masking and they're not gathering, that's going to help with flu as well. And I can tell you, that if you look at what happened last season, if you remember, as last season's, which is technically this year because it was like in March or so, when you look at the tail end of this past season's flu season, when we started putting in the masking and the stay-at-home orders and those kinds of things, that associated with a big plummet in our flu activity. So we know that if we can get people to continue to do these things, yes, them to get vaccinated as well, continue to distance and mask, that's going to help with flu transmission as well. We are going to continue to try to vaccinate as many as you can. As you know, we had our mobile flu clinic, which was very successful. We had another one scheduled, which we unfortunately had to reschedule because of the weather. But that one's coming up. Janette, is that this coming Saturday or next? I forgot what the date is.
It's November 21st at the Imperial County Fairgrounds from 7 a.m. to 10 a.m. And, face coverings are going to be required. I highly encourage that, people wear short sleeves. It just makes it easier for the nurses administering the vaccine. Take some snacks because, you may wait for a little while, take some water and snacks. But yes, it's on November 21st at the Imperial County Fairgrounds.
Okay, we did get something from Janette today then. Okay.
Yes, you did.
Okay. Did we miss anything? I'm not going to get into the politics of what's happening in Washington. We have no control over that. But, we have to hold out some hope that this will be taken a little bit more seriously. But did we miss it?
I mean, I try to stay out of the politics as well because I'm the health officer for everyone. And I just want to say that your point is well taken. Is we want to make sure that everybody understands that at every level that the public health community is in lockstep in trying to stop this pandemic. And all of the things that need to take place, on the larger scale with regard to we encourage people to continue to limit their interaction with other people outside of their household, all of the medical interventions that are taking place, all of those things are super important and they need to keep happening. And I after such a long period, I get that people are getting fatigued and it's difficult. Humans are social and they want to interact with each other, but it's just so important if we can just hang on a little bit longer. There is a light at the end of the tunnel. We're going to see these vaccines coming on board. They are going to become more readily available. And so we're going to have other ways to protect people. And that will make it doesn't mean that we won't still need to use common sense and distance and mask under certain circumstances, but it will take some of the fear off and allow us to get back closer to what we consider normal human interaction.
Okay. We appreciate the visit today and the information, and we just have to keep moving in the right direction.
That's right.
Okay.
That's right. Well, thank you for having us, Carroll. You have a wonderful day.
Well, it is Friday the 13th. We'll try and make the most of it. And Dr. Munday, Janette, both of you, have a great day. Have a great weekend. Remember, wear a mask and socially distance.
Thanks, Carol. You have a wonderful weekend as well.
Bye. Thank you.
And by the way, that interview will be available on the KXO YouTube channel and on our KXO website in case you want to go back and pick up maybe what you missed.